Hello, I'm Dr. Brad Eilerman. I'm one of the endocrinologists for the St. Elizabeth Regional Diabetes Center. I'm here today to talk about diabetes. Diabetes is a disorder of glucose. Glucose is a breakdown product of sugar. Glucose provides the major source of fuel in the body. When glucose is disordered, it can cause a number of problems. The first problem that elevated glucose can cause is a disorder of the body's ability to metabolize the proper fuel in order to live on a daily basis. This can become problematic in the sense that if you don't have enough energy to run the cell, you can feel tired, sluggish, and organs can experience dysfunction. The other problem that happens with regard to elevated glucose is that glucose can damage the body due to high concentrations damaging the blood vessel walls. This can damage the eyes, the kidneys, the nerves, among other organs. It can also damage the heart and the liver. The elevation of glucose in diabetes is primarily revolves around disorders of the hormone insulin. In type 1 diabetes, a person does not produce insulin due to the immune system attacking and destroying the pancreas. This leaves a person completely dependent on taking insulin as a medication. Type 2 diabetes, which is much more common, is more complicated. In type 2 diabetes, most of the time, people continue to make insulin, just not enough for their needs. This occurs because of a phenomenon known as insulin resistance. Insulin resistance is the body's difficulty using insulin to let the glucose inside of the cell. A person with insulin resistance can make the same amount of insulin as an average person, but not have the same degree of glucose control. Insulin resistance is affected by a number of factors, including your genetics, but also your activity level and the types of food that you eat. The things that we get concerned about with regard to long-term exposure to elevated glucose and insulin resistance largely exists around a group of symptoms that we recognize as cardiometabolic risk factors. This includes accumulation of fat around the organs, primarily around the middle, fat that develops in the liver, fat that develops in the heart, and then the blood vessel considerations that we talked about earlier. Overall, this can increase a person's risk for heart attack and stroke. So glucose control is very important overall in order to get the best outcome over a long period of time. Insulin is the most important hormone with regard to diabetes. Think of insulin as the key that opens the door that allows glucose to flow inside of the cell. In an average person, insulin goes up when you have increased needs, like when you eat or when your blood glucose is running higher, and goes down when you have less needs, for example, when you're fasting or when your glucose is lower. The challenge in diabetes is that when insulin is dysregulated, glucose can go high when you don't produce enough in the setting of a meal, but it can also sometimes go low in the setting of having more insulin than you need. For example, if you're taking a medicine that causes your body to make insulin regardless of whether you're eating or not. This provides one of the central challenges with regard to regulation of diabetes. In a person without diabetes, this all happens automatically. You don't have to think about it. When you eat an ice cream cone or a piece of pizza, your body knows exactly how much insulin to make, and the glucose flows into the cell and the glucose stays rather even. If you have diabetes, your body is unable to react in a precise manner. This leads to elevated glucose in some occasions, and that's why we give medications. The challenge with the medications is while the medications are helpful with regard to bringing the glucose to a lower point, it's not necessarily exact. It's all educated guesses. Guesses in terms of what your doctor provides, but also guesses in terms of what you may want or need to do with regard to your medication or the types of foods that you're eating. For this reason, it's very important for a person with diabetes to understand what they're eating, what their activity levels are, and what their medications do to their body. Certain foods have different impacts on the body's release of insulin. Foods known as high glycemic index foods have carbohydrates that flow immediately into the body. In a person without diabetes, this generates an insulin spike that brings the glucose level from high to normal very quickly. A person that has diabetes may be unable to produce a response in reaction to a high glycemic index food that enters the body. In that case, the blood sugar goes up very high and may not be able to come down. Examples of high glycemic index foods would be white bread, things like rice and pasta, but also things that you may not expect, like bananas and grapes. So not all foods are going to react the same. On the flip side, low glycemic index foods can keep the blood sugar more even because the carbohydrate intake is much slower. So foods like beans, fleshy fruits like apples, berries have low glycemic index and are much safer to eat because of the lower chance of a glucose spike and the inability of insulin to be able to keep up with it. One other thing to keep in mind with regard to high glycemic index foods is they don't just do damage in the short term. Over time, the body's reaction to spikes in glucose can lead to the pancreas failing faster. So a person who eats poorly not only puts themselves in danger of having high glucose now, but also even worse glucose moving into the future. One thing a person can do to mitigate glucose spikes after they eat is engage in activity immediately following a meal. In fact, if you have the opportunity to look at your glucose in something like a continuous glucose monitor, you can see the fact that a walk following a meal can often lower glucose more than a medication. And so you have a lot of control over the kind of activities that you engage in and the kind of response that your glucose generates. So in conclusion, I think the most important things to understand is that diabetes is a disorder of glucose. It's primarily due to dysregulation of the hormone insulin. Food has a very strong role in your body's production and reaction to insulin, and you have power over the choices that you make with regard to what you expose your body to with regard to glucose release and the degree of activity that you have that helps you burn glucose. So hopefully this is helpful as you move forward.